Hey there, I am the CEO of I Raise Girls and Boys International Corporation, Shanequa E, born and raised in the Bronx, New York. I am excited to announce that I Raise is one of the leading community-based organizations in New York City, both women and Black-led, leading the charge in kids' youth mental health. Over the next 2 weeks, we'll be holding a mental health session, which will garner our trusted partners, foundations, to discuss the new discoveries within school mental health in New York City. We'll be discussing our research, our groundbreaking strategies, and a new model that will allow us to expand our reach to 50,000 youth in just 3 years. We're inviting you because we believe that together as partners, we can truly change the face of youth mental health in New York City. Over the past year, I Raise has worked tremendously hard behind the scenes to make sure that we continued innovating. We specialize in what's next in mental health. We believe that mental health should be a way of life, and we have been working to create a model that allows all people, regardless of their background, to see mental health as essential, as pivotal to our everyday lives. I imagine a world where policy is directly connected to the everyday impact of what people face. I imagine a world where Blacks and people of color have access to essential mental health care, and a world where our schools have a universal streamlined model to really support kids' mental health. I'm really excited to bring some updates about what I Raise Girls and Boys International Corporation has been up to over the last year. Starting off in May 2022, we held our New York Mets fundraiser, where we invited several local foundations and organizations and partners to join us in a conversation about how crucial young people mental health is during the pandemic. We talked about our research, in which we embarked on 2 very unique but pivotal studies. One, measuring the psychological well-being of young people during COVID, where we were able to garner the responses of youth right in New York City. They shared their pain. They shared their fears around death, COVID, their loss, so many things. We're able to aggregate that data, analyze it, and to provide best practices and recommendations to our city, school, to our elected officials. And we use that data to innovate our programs, to help and to ensure that kids, when they came back to school full time, they came back with their safety and their mental health in mind. So we work with schools throughout New York City to prepare them for a safe return and a safe reopening. And we're excited to announce that we have been able to work with over 3,000 kids throughout the pandemic up until today to ensure that they had a safe transition back to schools. We've worked with countless educators, social workers, and principals to make sure they felt supported through designing trauma-informed trainings and professional development that help to enhance the learning of our teachers. We help to create sustainable classroom models that allow teachers to really understand what are the triggers that kids are facing when they are in schools. We've been vocal and at the forefront of mental health issues over the last year. We've been able to pivot our integrative mental wellness model and looking at a macro perspective. How do we shift the needle? How do we change the game? How do we create a universal mental health model that's sustainable for the Department of Education to thrive and to ensure that every child in New York City public schools have access to crucial mental health services that they deserve? Yes, mentorship is absolutely important. The benefits are lifelong. So kids, young people, they benefit from this for a lifetime. So whether you're pouring in through money or you're pouring in through knowledge or skill
Right.
or love,
Right.
that's going somewhere. We're excited to announce over the next year, we'll be working with 30 school partners because of funders like New York Community Trust, who has taken a chance on us to pivot our model and to expand it to as many youth as possible. We're excited to announce that we are also teaching a mental health aid workshop to all teachers and all students in New York City public schools that are interested. We're also developing our mental health aid assessments, which will measure the mental health of young people and what they need. It will allow the schools to have a tool to assess benchmark data and to begin to provide targeted, customized mental health plans for their students. There are so more things to come. We must highlight these initiatives. We must highlight the things that our families need. We must highlight and be the voice to many youth and many families that may feel voiceless, may feel overlooked, may feel ignored, may feel not heard. We are the voice. We are the voice to our youth. And what voice are we? We are the voice that amplifies what they need, their pain, their story, their struggle, and what they need best in order to thrive. When you think about mental health, I don't want you to see it as a diagnosis. It is a way of life. Just as much as we check on our physical health, we must check on our mental health through wellness checks. We must do things daily to sustain our minds through self-care planning, through prioritizing ourselves, and through things that we have never imagined to make sure that we are as strong as we need to be. We are thriving as much as we need to be so that we can continue to show up for the world.